here to give intramuscular injection, and I will start by gathering my supplies. I have 3 milliliter syringe. I have 1 to 1.5 inch of a needle. I have alcohol wipes. I have my medication. I have my gloves, and I have my gauze just in case. So then I'll go ahead and confirm the 6 rights of patient medication administration, which is the right patient, the right time, the right dose, the right drug, the right route, and the right documentation. And then I'll go ahead and confirm the orders of the EHR, which says that I administer 6 milligrams of morphine sulfate intramuscular. I have confirmed with the EHR, and that tallies with what I have. So then I'll go ahead and calculate the medication that I need to draw from the medication that I'll need, the dosage. I'll do a dosage calculation. So then the order says administer 0.6 6 milligrams of morphine sulfate, and at HUD I have 4 milligram per ml. When I do my calculation, it says, shows that I'll be giving 1.5 ml of morphine sulfate. So then I'll go ahead and approach my patient. Good morning, Mrs. Smith. My name is Valentine, and I'm here to provide you with your medication. Is it a good time? Okay then. So I'll provide privacy. I'll perform hand hygiene. Mrs. Smith, may I use your name and wristband to confirm your name and date of birth? Can you verbalize that? That tallies with my record. So then I'll go ahead and discuss with you why I'm here. I'm here because the physician ordered your pain medication, which is morphine sulfate. It is your medication for chronic pain, and yeah, this will help you with your pain. So morphine sulfate works by blocking how your brain and your central nervous system, how they perceive pain, which will be of help to you considering the amount of pain you are in. So I also want to let you know that the medication may have some side effects, which include headache, dizziness, and shortness of breath. So just in case you experience all those, you need to be careful, just in case you change in your position when you're in a sitting position, or when you're getting out of bed. Be careful not to do it in a way that you will end up falling because of the dizziness. It may also have some adverse effects, which I want you to report just in case you notice any of these. The adverse effects include respiratory depression, constipation, and dizziness, nausea, vomiting, and stomach upset. I want you to report just in case you have this feeling of adverse effects. Do you have any questions so far? Okay, then I'll go ahead and prepare your medication. I'll perform hand hygiene and don gloves. So I will then go ahead and inject 1.5, or before then I will clean the cup of the medication. So I will clean for 15 seconds, not to introduce germs or any bacteria on the medication. 15 seconds. So then I'll go ahead and instill 1.5 ml of air in my syringe. Let me prepare this. I'll instill 1.5 ml of air. And then before I invert the vial, I'll go ahead and inject the air, all the air in the bottle, in the vial, and then I will invert and draw 1.5 ml of medication. and I'll make sure I don't have any bubbles before I inject. So I'll remove all the air. No bubbles, and I have 1.5 ml. So I'll set that down, and I'll go ahead and locate where I want to inject. I will locate a nice anatomical landmark. So what I'm gonna do, I will place my thumb on the trochanter area like that, and then have my finger facing the iliac like that, and then I'll go ahead and mark one anatomic spot, and by then I'll be inspecting the skin to make sure there is no any skin breakdown, there is no edema, there is no any bruises. And I also need to let my patient know that when you're injecting the medication, you may experience some burning and stinging sensation when I inject the medication. And yeah, so I have inspected the area. The skin look intact. There's no edema, there's no breakdown, and I have marked where I want to inject my medication. So I'll go ahead then and get a clean alcohol wipe and clean the area. Make sure that it's all clean. That way we don't introduce infection as we inject the trash that. I'll wait for it to dry up, not touching the clean area, not to introduce germs. And then I don't want to brew the area, so I'm just gonna wait and still mark my anatomical landmark. I'll then go ahead and place my thumb and my finger towards the area and trochanter area, and then press I intend to pinch the area to increase the muscle size, and then I'll advance at a 90 degrees. So at 90 degrees I will inject 10 ml per second. So I'm not gonna be I don't want to dump the whole thing in there, so I'll be super slow and nice with my patient, and then I'll wait a little longer for the medication to get into the muscle. Then I will remove and I don't want to decap this, so I'll put it in the sharps. I don't want to massage, and maybe I can insert pressure just in case I see there is anything oozing, but the skin looks nice and okay. So I'm not gonna massage, I'm just gonna wait for maybe 10 seconds to see what will happen. So then I will go ahead and remove my gloves, perform hand hygiene, and document. Thank you.